Welcome back. I'm Dr. Irfana Patil from Forever Young Skin Clinic, Kolhapur. And today we are going to discuss about a very common skin problem, that is urticaria, a skin allergy, or it is also known as hives. Also known as Pitta Kande in Marathi and Chapaki in Hindi. Now, urticaria is something where at least once in a lifetime the person will have such kind of problems. This urticaria may be acute or maybe a chronic type of urticaria, which is like more than 6 weeks duration. And there are certain other types of urticaria also, which is called as physical urticaria, which are triggered by the physical factors externally. So basically, how this urticaria presents, like what do you look for, or what are the clinical signs and symptoms of urticaria? So urticaria usually is seen as very itchy, red colored, bumpy lesions, which can be very small inside, or they can be also like huge swellings. They can appear on any body part, and sometimes they can be limited to one body part, but they can also spread to the rest of the body as well. Now, sometimes the urticaria or these skin lesions can also be accompanied by some systemic symptoms also. So, what do you look for? What kind of systemic symptoms can happen, can be an alarming sign when this urticaria occurs? So there can be a difficulty in breathing which can happen. There can be a headache, dizziness, giddiness, or loose motions, pain in the abdomen, and swelling of the lips can also happen, which is called as angioedema. And the angioedema of the mucosa can also cause the difficulty in breathing and a constriction in the larynx, and hence the patient is not able to breathe. All these systemic symptoms are not always associated with the skin lesions. These are very severe kinds where they can lead to anaphylaxis also. Now, today I'm going to just discuss about the skin lesions and what are the factors which can trigger this urticaria. So, when you get this urticaria first time, we don't know whether it is acute or chronic. Chronic in the sense when the urticaria problem is more than 6 weeks. So, when you get this urticaria first time, there are very few common factors which can cause this acute kind of urticaria. So, most commonly, some kind of infections, viral infections, stomach infections, throat infections can cause urticaria. Any kind of food allergies, any kind of coloring agents, preservatives can cause urticaria. Seafood and egg, all these things, groundnuts, peanuts, even these can cause urticaria. So many kind of nuts, especially the peanut. Many people have peanut allergy. Then milk proteins also sometimes are. This is a very common factor which causes acute urticaria. So certain insect bites, especially honeybee or wasp, these also can trigger urticaria. Many medications or drugs, even they can cause urticaria. Now, whenever it is a food related urticaria, normally when you are taking that particular food item, after 30 minutes, if you start developing those lesions or hives, then that particular food may not be suiting your body. With skin contact or to many allergens like raw vegetables, latex, such kind of allergens can also cause or trigger urticaria. So when I discussed about how this urticaria presents, I mentioned about the lesions, the red color, very itchy lesions, which appear on the body. So here it is very important that these lesions last for few hours and then they disappear on their own. They have severe itching, but they do disappear within 24 hours and do not leave any kind of marks on your body. Now coming to chronic urticaria, or the urticaria which remains with the patient for more than 6 weeks. Now, for chronic urticaria, most of the times it is an underlying condition, an autoimmune disease, or many other hormonal issues like hypothyroidism or any kind of liver disease or any kind of autoimmune conditions like systemic lupus erythematosus. So there are many underlying systemic conditions which is normally associated with the chronic type of the urticaria. So many a times some patients come with this complaint that if they stroke the skin, they get red lines, or wherever, whatever direction they stroke the skin, there they develop those raised lines. Now that is called as dermographism. It is a kind of a physical urticaria. In the sense, any external physical factor like change in the temperature, sweating, pressure, vibration, all these physical factors will cause or trigger that urticaria. So some people also complain that if they take a shower with very hot water or very cold water, also they develop the urticaria. So this is also a type of a physical urticaria. Some people, when they go out in the sun, they immediately following the sunlight exposure, they get those lesions. This is also a physical urticaria. So basically, why this urticaria happens, what exactly happens at the cellular level that causes so much of a itching. So all the triggers will cause release of histamine and many other mediators from the mast cell, which causes the severe itching. So when you have urticaria associated with systemic symptoms, then it is alarming and immediate medical attention should be sought. And almost half of the people who have urticaria, they also experience angioedema, which I mentioned before about the swelling of the lips, swelling of the eyelids, swelling of the hands and feet, swelling of the ears and the genitalia, which can be painful. So if you are experiencing hive or urticaria, what should you do? Now immediately, if it is a very mild type, you can take a molecule which is levocetirizine to help you with those symptoms, to get rid of those symptoms. And also recognizing the trigger is also very important. Try to recognize what trigger has caused that urticaria. Now, if it doesn't subside with this, if it is troubling you, then you must consult your dermatologist for the same. And chronic urticaria, of course, it has to be totally dealt with proper investigations and a workup to rule out underlying autoimmune causes or any systemic conditions. So consulting a dermatologist for the same is again very important. And if your urticaria is having systemic symptoms also, then immediate medical attention has to be given to the patient, and you must consult immediately to avoid life-threatening anaphylaxis. So how is urticaria diagnosed? Urticaria is diagnosed, basically it's a clinical diagnosis, and in cases of acute urticaria, identifying the trigger like viral fevers or any kind of other infection or drugs or food is very important. So identifying the trigger is important, and some baseline investigations like complete blood count, absolute eosinophilic count, IgE levels are also done if the urticaria is not subsiding within few days, or if it is taking longer to subside. Now if it is taking more than 6 weeks, then a complete workup is required. Now, in few cases, if the urticaria is staying longer and if it is leaving marks on the body, then a skin biopsy is also required to rule out other conditions like urticarial vasculitis. So, how do we treat urticaria? Now, urticaria is treated with a combination of many medications and also other factors like identifying the trigger and trying to avoid that particular trigger. Now, a group of drugs called as antihistamines is the mainstay of treatment of urticaria. So there are older antihistamines and newer antihistamines. Now the problem with the older antihistamines is they do cause sedation, and they can cause drowsiness. So all these issues are there. So normally it is given usually at the bedtime. And the newer antihistamines are totally non-sedating antihistamines like cetirizine, fexofenadine, desloratadine. All these molecules are non-sedating and are preferred nowadays. So cetirizine, fexofenadine, levocetirizine, loratadine, desloratadine, all these are the newer molecules which are preferred nowadays, and even the dosing schedule is convenient compared to the older antihistamines. So in unresponsive cases, short course of oral steroids or cyclosporine and many other molecules are also used. So a person who has a history of getting urticaria lesions must always carry some antihistamine with him. So to conclude, now I will just jot down some points for you, that urticaria is not permanent. Urticaria is also not contagious. Simple urticarias will fade away quickly within few weeks, but if it is chronic urticaria, then there is an underlying systemic cause. Definitely, it is not related to any kind of allergies. Urticaria can be treated well by combining one or more or two types of medications. Many a times the lesions or the urticaria problem subsides on its own within few weeks or months, and then it also might reappear again. But if it is persistent, then taking treatment, consulting your dermatologist is very important. So friends, hope this video was useful for you and all your doubts about urticaria and its treatment part is very clear. Thank you so much. If you like the video, do like, subscribe and share, and remember to take treatment only from a board certified dermatologist.